Let me first say healthcare continues to eat a growing share of every American family's income. We know that from years of watching this and also from the testimony today. The trend is reflected by the healthcare sector consuming an increasing portion of our nation's GDP. In 2016, it's accounted for 18% of our GDP, but in 2026, it will jump to 20%, and that trend is unaffordable and unsustainable. And every day, like my colleagues, I hear heartbreaking stories from my constituents about how families are having to choose between paying for life-saving health care and other necessities such as groceries. So I am pleased to be an original co-sponsor of the Medicare for All Act and a founding member of the Medicare for All Caucus. This legislation will improve and expand Medicare for all Americans and will provide new benefits, including dental, vision, and hearing, all without copays, premiums, and deductibles. As I've said many times before, healthcare is a human right, and I believe that H.R. 1384 will help every American access high-quality health care. Ms. Ross, let me ask you, could you please describe how Medicare for All will save money and put our nation's health care expenditures on a sustainable financial footing?
I think the biggest savings in Medicare for All will come from administrative costs, because right now there are so many different plans to administer. Nurses and doctors just want to care for their patients. That's their main goal. So without the interference of those insurance companies, we can actually do that. So you've got the lowering of the administrative costs. You've got accurate budgeting, which we've not had before, that's actually sustainable.
Thank you. Madam Chairwoman, I'd like to ask unanimous consent to submit into the record a letter in support of H.R. 1384 from 253 leading economists discussing how this bill will reduce health care costs while guaranteeing every American access to comprehensive care.
So ordered.